Hello, my name is Gabrielle Basson. Today I am here with Dr. Heidy Bosch, who is from South Texas Health System. Today we will be talking about iatrophobia, which is a phobia of doctors or any medical help. And we'll be looking to see what small steps people can take into seeking the next step into looking forward. So, Dr. Heidy Bosch, thank you so much for taking the time today into talking about this topic. Can you start off with talking a little about yourself and your work?
Yeah, I'm a family medicine resident, and the first year family medicine residency program is 3 years. So for the ones that are not familiar with what a resident means, is that we are already doctors, but we are going to the specialty to be a specialist in family medicine. So I'm part of the South Texas Health System, and they reached me and say that you were interested to talk about it, and I say, yeah, sure, let's see what we can say and help. So for that reason, I accept. I didn't know that was a video, so but that's okay.
Nice, thank you so much. So, what can you tell me about iatrophobia, or just in general, people with intense anxieties of doctors? Exactly.
Well, iatrophobia is actually a combination of two words. So iatros always is coming from the Greek. Medical terms always bring a bunch of Greek terms, and it's a combination. The iatros is referring to the physician or the healer, and phobia, as people probably know, is fear, right? And it's really common. It's really common when we see patients, most when they are super young, teenagers age from 20 to 25 to people get really scared of when they are in the hospital setting or the family medicine setting. And I believe that it's more related with what is happening that I don't know, or what is going on that what will happening, like the unknown. So you can have the easy as just palpitation and blood pressure get high, or even sweating, full-blown anxiety from full-blown panic attack.
Yes.
So those are super frequently, and people don't talk too much about it. So I'm glad that you are touching the topic.
Yeah. So, how would you personally help someone who is showing this extreme level of anxiety during a doctor's visit?
Okay, so if it's the first time you are going and this is happening, it's super scary because you feel that you cannot breathe, you start sweating, and you don't know what is happening, you cannot control it. So I feel like doctor has to be aware if a patient is the first time that is happening or is something that is recurrent, so we can help better. If that is the case, suppose that I'm in the office and I see that a teenager or a young patient come in and I see it, usually what we say is like we try to bring down everything that we are doing. We are not doing anything until the patient comes down. And usually deep breathing is super helpful because the breathing calms down, and usually when you are in a full panic attack, the hyperventilation is what is bringing everything, all the symptoms. So if you are start feeling that an anxiety or palpitation or fear is coming, just control your breathing. Is one technique that always helps.
Nice.
And once that we breathe better, our heart gets a little bit low, we can function better.
Nice.
So that's the best way that I always try to do it. And always is like trying to make the patient comfortable. And when the patient is comfortable, we move on with what we need to do. Sorry, this is a hospital.
Yeah, it's okay. Okay, I'll just edit this in. Okay. So, does the setting where a doctor's visit takes place have any effect, like a hospital or a small clinic, have any effect with that?
Yes, definitely yes. When you have we have rules even that we follow in the hospital that we are more flexible with even for lab results. Let's put it in that way. When we have patients in the hospital setting, it's because one, they are sicker. So they are more serious, complex disease, right? That when you have a patient in the community setting or on the hospital, like in the doctor's office, is a patient that is stable. So we kind of like we modify a little bit the approach in the hospital setting to the community. Usually, you will see in a lot of doctors' office that they have, for example, magazines like newspapers. They have TVs,
Yes.
because all these are techniques that are already are in place.
Mm-hmm.
When you are distracted watching a video, when you are distracted watching music, you are not thinking on what is going to happen. And that's actually the first reaction, like the fear of what is going to happen, what like the trigger for the anxiety,
Yes.
and the sweating and the palpitation.
Mm-hmm.
So all this is a definitely a huge difference. In the hospital setting, we don't have all those accommodations.
Mm-hmm.
We have a lot of machines, a lot of staff, the bed, the AV machine that usually beep a lot. So it's a lot of stress,
Yes.
stress in the hospital setting
Mm-hmm.
that can affect to have that reactions, of course.
Okay. When treating a patient with this fear, is it best for your doctor to remain strictly professional and calm, or more of an easygoing, friendlier approach?
You will have different approach, and it depends of the doctor's experience. In my experience, I try to make them see that I'm a human too. I'm not like a far away person, or I'm not like a person that you cannot reach. I'm human. I'm here. Let's work out what is happening, what are you feeling, how I can help. Let's take a deep breath. Let's calm down. You need some water. So all these techniques help. Uh, Again, as friendly as we can be, people calm down, because people get scared of who is this person that I first met, and that's usually the trigger, right? So you will have another doctors that they just stay calm, quiet, and allow you the space. Even another one is like, do you prefer that I step out of the room so you can come down?
Okay.
So depends of each person. We are completely different.
Mhm.
We react differently. So it's only one approach is no the rule. You can have different approach to get different reactions.
Okay, interesting. Would allowing a patient to have more control, like asking more questions or having another person there with them, help them more with easing their anxiety during a visit?
Definitely yes. So if that's actually one of the recommendation, the most recommended is like, if you feel like you don't have control of your body, because that's what is happening, bring a person with you. Bring somebody that you can trust, that you can allow them to be with you and ask questions for you. And another technique that I always say is like, inform yourself about what is happening. Suppose that is a procedure, right? Go to a trustful source, because you can see in the internet and everything and anything, right? So go to a source that you can trust. Usually universities has a lot of videos. If it's a medical procedure, any university has medical procedures that you can trust, that is doing like the procedures doing with doctors, for doctors, for training purpose. So those are the best. So because those are the easy way to learn. If it's a procedure or any kind of situation, right? Inform yourself, and if you are still apprehensive, still anxious, still nervous, bring a person with you. And that's actually the best recommended. And if you can, write your questions before ahead of time, because when you are in the doctor's office, you forget. You get nervous, you forget. So write it down, and that's the best way sometimes to go smooth with the appointment or with the procedure or with any situation.
Okay, that's very helpful. So we talked a bit about how in different ages people are scared of seeing a doctor. Does age play a big role in iatrophobia, especially like, do kids have it more rather than adults?
Actually, kids know. Kids, most what happened with kids is like, they are afraid because of prior experience that was not really fun. So if you break that, if you have a history, for example, that, oh, he cries a lot with vaccines, so that means that something happened, the vaccine was too painful, and the person still have the fear of the vaccine, right? Or the baby, or the kid, or the toddler. So usually the approach is different. You will see that in the pediatrician's office, our scrubs are more colorful. They have candies, they have lollipops. Even the stethoscope that we use sometimes is more colorful, has some toys around to distract, to bring down all the anxiety for the kids, right? But kids are really easy to handle in that way. Adults are more complicated because our ideas are more complicated, more complex. So all the fear is more is harder to pass. So definitely completely different, and you will find that more in adults than in kids. In kids, parents are usually in the room. Parents are our best friends, and they know how to handle more when they are afraid, when when they have some anxiety, and you use that as a doctor, right?
Yes.
Like you use your parents for control the setting, for put the mood nice. When you are an adult, sometimes you don't have a good person to go with you. Your parents are working. You have to go to the appointment by yourself. So it's hard.
Yes.
It's harder.
Definitely.
So I always say, like, no worries. You are in a safe place, and like, I want to point out that everything that happened in the room with the doctor is confidential, so we cannot share it. So don't be afraid if you start crying, if you start yelling, because that's part of what can happen. So that's no embarrassment, like no point, no worries about that. Like we are trained to deal with that, and it's perfectly human reaction when we are afraid of situations. So
Okay, wow. Now, I just have two more questions for you.
sure.
So, what are some techniques or strategies, including breathing exercises, that someone can do to ease their anxiety before or during a doctor's visit?
Sometimes the easy and simple, everybody has a phone, right? So sometimes, again, I mentioned some videos that calm you down, music that you know that calms you down. Usually it's good the music that, or the audios that help people to sleep. So every app that you can find that for when people has insomnia is good for calm you down, because that is relax enough so you can take your breathing down. You can be more aware of what is happening on your body, and those are always helpful. So, and it's easy. Everybody has this day a phone, so you can put on your earpods and put music to relax you, videos to relax you. And the best is to inform yourself before, because the unknown is most the trigger. The waiting is the trigger too. So if you know that is an appointment that will take, the waiting time is 30 minutes, you have like 30 minutes of anxiety, of symptoms. So bring your phone, bring your audio, bring your music that calms you down. And I feel that this is the easy way. You can find a lot of things in the internet that can help you, but I feel like if you do it easier, it helps always. Not everybody has like a lot of means to find things, expensive things, but everybody has a phone. So I feel like that's helpful.
And the more they practice these, the more they get
Definitely.
used to it, the more they get used to visiting a doctor. Yes?
Definitely, the exposure, like, and usually all phobias, the treatment is exposure, like exposure reaction. That's what doctors do. So I feel like one thing that you can do is visit the hospital setting, visit. For that reason, I ask you, have you been in the hospital before? You say no, first time. So
Yes.
that's a real. If you are afraid, probably anxiety because you don't know where you are, you never have been here, and you are not sick, right? You are just doing an interview.
Yes.
So, and it's a lot of reasons to be anxious about it, right?
Definitely. For sure.
So, and again, the best way to do it is like to visit a place, or if you are going to a new doctor's, visit the doctor's office before your appointment. See how is the place, see the staff, ask questions, and all this before ahead helps. And yeah, you will be able to manage better the anxiety, the palpitations, or even the panic attack, to avoid it.
Okay. Well, finally, for my last question, what advice would you give someone who is watching that wants to take the next step into seeking the medical care they need, besides, having so much anxiety?
Okay, you will have a lot of people saying that if you are afraid of blood, you cannot be a doctor, right? Most of the time, we never have been exposed to traumatic situations. We never. I didn't even. I knew that I want to be a doctor, and I didn't have the exposure to be in a traumatic setting. I feel like knowing or try to meet people that is in the field, that's always helpful. Like if you have elective rotation, if you have elective classes, to get the ones that will bring you close to the field. So if you want to be in the field and they have like a CPR classes or CPR club or any kind of healthcare club, join. Because that's the best way to expose yourself to decide if, oh, that's what I want to be, or that's what I like to see, that's what I want to do for my life, right? So if you have family members that are nurses or are physicians or are PAs, take their experience. Ask them how is life, how is work, how they do. You can volunteer in any medical family medicine is the best way because you can see every age. If you go to ophthalmology, you will see only ophthalmology disease, right? If you go to the internal medicine, you will have only adults. You will be not exposed to kids. Yeah. So I feel like the more broad that you can expose is the best. So, any other question?
That was my last question. Thank you so much for taking the time today again.
No
I'm pretty
problem.
sure this conversation can for sure help someone with taking that next step into seeking the medical care they need. Thank you so much.
Thank you,
Gabriela.
Gabriela.
Thank you.